Welcome to ETSU Department of Psychiatry Grand Rounds. Dr. Evans is our lecturer today. He's currently one of our faculty members, Professor of Psychiatry and Behavioral Services, Associate Director for Outpatient Services here at the university as well. Dr. Evans was educated at the American University where he's got his Ph.D. in clinical psychology. He got his Bachelor's of Science at Tufts University in Medford, Massachusetts as well. Postdoctoral fellow in clinical psychology at Yale University School of Medicine, and also postdoctoral education, certificate at Advanced Psychotherapy Training Program, Washington School of Psychiatry, a 3-year program in psychodynamic psychotherapy, certificate in program in management development at Bryan School of Business Economics, University of North Carolina, advanced clinical training program, National Center for PTSD in Palo Alto, California, and completed 3-level training in therapeutic assessment with Stephen E. Finn Center for Therapeutic Assessment in Austin, Texas. Dr. Evans has worked at a multitude of VAs in Asheville, Charles George, the VA there. Also worked at the American University, as faculty there as well, and another other facilities out in Bozeman, Montana as well.
Right.
Dr. Evans has got a multitude of publications in personality disorders, psychological assessment, and PTSD. So I'll leave it to Dr. Evans.
Thank you. Can you hear me okay? All right. So I'm going to present on one of my absolutely favorite topics, which is the variously called the Rorschach test, or the Rorschach inkblot method. How many people have had any direct experience with the Rorschach? Okay, great. So most people don't know what the test is. And so I have a little section in here that's going to talk a little bit about what we do, because quite frankly, the sort of standard view is it's kind of the Ouija board of psychological assessment. And it's there's some ways to practice it that you can do it that way, of course you get the results that you get from that. But I'm going to be talking about a method that's really quite scientifically sturdy, which is kind of hard to imagine with a kind of set of 10 ink blots. So here's my disclosure. I receive royalties from the sale of 3 books, and 2 of which could be perceived as a real apparent conflict in the context of this. As you can see, 2 of those books are on the Rorschach, and particularly its use in court, in forensic settings. Okay, so, we're going to talk a little bit about today is, what happened to the Rorschach, what have been the criticisms, what's the scientific evidence for the Rorschach, and what are the unique advantages of the Rorschach in multi-method assessment. But I thought we would, first of all, let you see Hermann Rorschach. Kind of Brad Pitt-like guy, huh? That's not Brad Pitt, that is Hermann Rorschach, who was a psychiatrist and artist. A very interesting combination, and was in Bern, Switzerland, and contemporaneously with Jung. He was younger than Jung, but they were practicing at the same time, but in some ways really didn't cross paths, even though they have a number of ideas in common, which is very interesting. He's, again, Swiss-German descent. His father was an art teacher. His nickname was Klex. Anybody know what that is? It means blot. He was fascinated with ink blots because one of the really, really popular party games of the time was called Klexon, which roughly translated is Blotto. Now, it's different than an American college version of the game Blotto. That's funny. Anyway, what would happen is that people would come to a party, there would be paper and ink, and people would, you know how to make an ink blot, right? Take a piece of paper, drop some ink on it, fold it over, open it up, and let it dry. And then it's kind of, sort of like people pass it around and people would come up with unique responses. Well, observant future psychiatrist Hermann Rorschach began to say, that's kind of starting to notice a pattern in the way that people respond to these things. Well, and he became kind of fascinated. It became a wildly popular game to the degree that, like, stores would sell, so that you wouldn't have the muss and fuss of the ink and the mess, they started selling card sets. And so, anyway, so that's kind of where his childhood interest was, in ink blots. He then became a student. I don't know if people are these days familiar with Eugene Bleuler, but he was one of the earliest thinkers in the concept of schizophrenia, about the same time, actually pre-Kraepelin, and had a kind of a different point of view than Kraepelin, who was more categorical, sick, well, whereas Bleuler tended to look at processes along a continuum. And so people could have schizophrenic type experiences without being fully schizophrenic and that sort of thing. And he was very interested in particularly the way that schizophrenic individuals saw the world, interpreted the world, and constructed it cognitively, thought about it. And so here we have a guy interested in ink blots, meeting with one of the great thinkers in schizophrenia at the time, and this kind of very interesting collision came together, and Rorschach thought, maybe we can construct a test that would help us pick up these problems in reality testing and thinking and thought disorder in a way other than asking somebody, do you have a thought disorder? Do you have problems with reality testing? There's an inherent problem with doing that, which I'll address a little bit later. But this gave, it was really a kind of an attempt to see if these ink blots could really elicit the kinds of behavior that would be harder, these implicit behaviors that would be harder to find otherwise. And so he did pretty nice, for the time, research on this with he developed a 20 card set, and that was too expensive. Then he knocked it down to 16, and then he did 12, and then finally he got a publisher who would do the 10 cards. And those are the standard cards. Obviously, if we had more cards, we'd have a greater way of looking at behavior. So, but we have the 10 cards, and that's what we have. And so we try to mine the information that we can from those 10 cards. He published a book in 1921 called Psychodiagnostics, using the Rorschach, where he focused particularly on form-level indifferences in schizophrenic individuals from normal individuals. So he gave blots to kind of the sort of run-of-the-mill normal control subjects, and he gave the blots to people in the hospital that he was treating, and he found very significant differences. And the Rorschach's capacity to assess reality testing and thinking disturbance turned out to be not only a wonderful discovery at the time, but it remains the single strongest thing that the Rorschach can do. Even critics of the Rorschach will acknowledge that the research on form-level reality testing and funny thinking are very compelling. So, how does Rorschach work? First of all, the underlying assumption is how we view and interpret the world can reveal much about our implicit mental and emotional processes. When we show the card, and I ran off quickly without the card, so I'm going to hold up a card that's an imaginary card. People know what card 5 is? What's card 5? Anybody remember? It's a simple card. It's the bat card, right? They thought it was a blot. It isn't. It's actually a drawing because, and we'll talk about that in a bit. And so you say, what might this be? Well, that card looks like a bat. Really does. A bat or a butterfly, a flying squirrel, or something like that. It looks like a whole bunch of different things depending on how you organize it, but if you look at the whole thing, the immediate percept is that of a bat. 50% of people of control norms will see a bat in that. 50%. That's a lot for a single response. So the focus is on matching the response to the external reality. What might this be? What does this look like? It's not what do you imagine this to be, what's a creative response that you can think of. It's the directions are saying, what might this be? What does it look like? And so we also take a look at the underlying thought processes besides this. So this is a bat with blood-dripping fangs who's coming after me. It's a little bit different response than this is a bat. Okay? So these elaborations can really let us know something about underlying thought processes and see the aggressiveness in that movement, the personalized quality of it, the threatening notion of it. And that the other thing we need to understand is that the response process includes editing and excluding responses in a social context. So you look at the card, and look, there's a lot of sex on these cards. A lot of sexual parts and things like that. How often do people ever share those? Very rarely. If you tell a person, say whatever comes into your head, what you see, don't edit it, don't hold back, things like that, you'll get those responses. But in the standard instructions, you're going to be able to see a person's capacity to contain certain images that are socially appropriate or not. And so if somebody gives you a lot of sex responses, that's a person who's having some trouble with the pressure of their own sexual thoughts such that it's an unusual kind of response within the context. So when we give a Rorschach, what we do is we hand them the plate and say, what might this be? We then record verbatim what the person says. So you're getting a very nice sample of verbal behavior in response to this. And then when the person gives you 2, maybe 3 responses to each card, you move on to the next card. And you go through all cards and you get initial responses to all cards. At which point you then go back through the cards again and say, look, I'd like to go back through these cards again. And I want to basically try to see what you saw in the way that you see it. And for instance, I want to know where you saw it and what makes it look like that. And that inquiry is guided heavily by the scoring system that we use to develop an empirical scoring system that brings empirical rigor to an otherwise psychologically rich test. You can have a psychologically rich test, but if you don't have empirical rigor, you don't know what you're getting. Are you getting something from inside of you? Is it a reasonable interpretation? How do you check your judgment? How do you check your own conscious and unconscious biases? And of course, the empirical literature allows us to do that. One of the things that psychological testing does over interview is that it provides us with some data to be able to check our biases at the door. So then we score the Rorschach, and you can see we do 9 different procedures on every response. We're looking where things are, whether things, developmental qualities, whether things are in connection with one another. Determinants are, is it simply form, or is it color, or is it movement? Is it reflection? Is it shading? What type of shading? And then we also the kind of key of this test is the form quality, the degree to which the percept matches the blot. And then we score that in terms of whether it's an ordinary response, which means that 10% of people, 5% of people see it. An unusual response, which is one that fits the contours of the blot, but is like 5%, less than 5% of people see it. And then we have minus responses, which are very important because they let us know These are responses that do not fit the contours of the blot. Are there pairs? That tells us something about interpersonal relationships. What are the kind of contents? Old Rorschach was all about content analysis. As you can see, it comes pretty low down the list here. Is the response popular? Is it one of those responses that at least 25% of people respond to? And then is there a Z-score, which has to do with another thing about integrating responses? And then the other area, which are special scores, which are things like fabulized combinations, where two things that are stuck together that don't make sense. Okay? Here are two boys playing ball standing on a pedestal in the mud. That's actually a real response from a very major case. That is not a good response. The person is seeing things and they're putting them together, but in a kind of odd way. And so we know that at least in that one response, we get some kind of funny thinking going on. But any one response is not going to tell us something. We don't want to ever take one response and go from, in the old waste test, one swallow doesn't make a summer, okay? That's a test of abstract thought. One response doesn't make anything other than it's one response in the context of overall. So in interpretation, there are three steps. We list the codes or scores, we record the frequency of each variable, and then we perform various calculations that get ratios, percentages, and derived scores. And all of these variables are selected on an empirical basis or organized in a conceptual basis. Actually, with the new RPAS system, only variables that have at least fair empirical support for it are ones that are included in that system. And I'll talk about that in a little bit. And so you're doing this and you get all of these scores and you look at them along 8 different things like reality testing, thinking, degree of development and organization, interpersonal and self concepts, response to stress, dealing with color. It's another thing that's very good in the Rorschach. Color tends to be related to what kind of human implicit process? What would you think, just off the top of your head? Emotion, exactly. It turns out you think, that's just too obvious. But it actually turns out empirically to be true. How people manage, use, or include or exclude color in their Rorschach will say a lot about how they manage emotion in the real world. What's nice about the Rorschach test is these are not opinions about oneself that you get out of a self-report inventory. These are actually responses that are tied to research and real-life behaviors. So is it a projective test? Everybody calls a Rorschach a projective test. Is that right? Is there anybody, any Rorschach personality assessment geek want to disagree with that? Here it is, it's a blot, you project. Well, what's the projection in the bat? Is there projection in that? No, that's what it looks like. There's no projection. If the bat's flying, that's projection. If the bat has dripping fangs, that's projection. But actually, the Rorschach is primarily an open-structured personality test that has ambiguous stimuli that allows for direct client observation. And it looks, first of all, at the form of the test and then moves on to other sorts of things. So it's not so much, it's a good performance-based test with nice projective features. So what you get is what I call nomothetically based idiographic assessment. So we get a picture I've never had I actually had one set of Rorschachs that in a child custody case where both of the parents and the child gave almost identical Rorschachs. It was kind of spooky because I'd never seen that before, that Rorschachs that were similar looking. They're usually, I kind of think of them as sort of the psychic thumbprint. But, but generally speaking, what we're doing is trying to get a picture of the person, of the individual, as best we can using nomothetically based information. So up until John Exner got into the Rorschach world, he wrote a book. There were actually 5 systems of the Rorschach, and he wrote a book called The Rorschach Tests. And he said that there's no Rorschach test anymore. There are 5 tests that have different instructions, they're scored differently, and the systems, more or less, usually less, base their interpretation on empirically derived data. So in 1973, he developed what he called a comprehensive system, which was to draw all the variables that he could that had empirical support, and to develop a Rorschach administration and scoring and interpretation system that was based on empirical information. He developed a broad normative database, which is hard. You know, a Rorschach takes about an hour to give, more or less. It has to be coded reliably, so you have to train reliable coders. So gathering data for the Rorschach is a lot different than gathering data for the MMPI, MCMI, or PAI. Because PAI or MC, you hand somebody, actually you put them on the computer now, you hand them a bubble sheet, they fill it in, you scan it, and then bim, bam, boom, you do the research on it. It's a little bit different with the Rorschach. So we have an integrated system of scoring and interpretation. Every scoring category was included only if there was an inter-rater reliability of about 0.85. There was 85% agreement to whether this should be a scoring category initially. Interscore reliabilities of 0.82, that's pretty impressive, to 0.97. And then retest intervals went from 0.26, which is nothing really to write home about, up to 0.92. So there are a number of variables on the Rorschach that show very nice test-retest reliability over the course of a year. What's the test-retest reliability, just off the top of your head, what's the test-retest reliability on the most solid, firmest, reliable scale on the MMPI? Scale 4, which used to be called psychopathic deviancy, had a fair test-retest reliability after 6 months. It's the only one that has really solid test-retest reliability. And yes, it's used as a test of major personality characteristics. So it gives you some sense of the difference. And then, of course, ratios and percentages, which are derived scores, show higher test-retest stability. At one point, it's now, I think now at the 4th most used personality technique. But it's the second most widely researched personality assessment technique with adults, children, and adolescents. I ran a psych lit. I just put Rorschach in the psych lit. And in 2002, I got 8,241 hits. I did it yesterday, and we got 11,253 hits. That's a lot of hits. 6,471 were hits in peer-reviewed journals. MMPI has over 13, close to 14,000 hits and nearly 10,000 peer-reviewed articles. That's a fairly impressive literature. To say that there's no literature, scientific literature, on the Rorschach, it just kind of flies in the face of one simple reality. You can talk about the nature of that data, which is a good thing to talk about, but the idea that the Rorschach is not a researched test and not written about is just simply untrue. And so I just want to say that we now use a term for tests like the Rorschach the TAT, the Adult Attachment Projective, the Roberts Apperception Test for children and adolescents, and tests like that, the Vardig test. We're not calling those tests projective and we're not using projective and objective anymore. We're talking more about the response process, which is a self-report versus performance-based methods. So Rorschach and the picture story tests are all going to be performance-based methods. What they're doing is gathering samples of verbal behavior in response to a standard stimuli and developing a coding system in order to derive empirically validated meaning from this. I think we can do this, okay. So I'm just kind of jumping ahead looking at time. Why don't we use the Rorschach more? What happened to the Rorschach? How many people here heard that the Rorschach is not reliable? You shouldn't use it in clinical and certainly not use it in forensic settings. Nobody? Okay. There's been a major in the, how many folks are psychology folks here? Okay. So you're going to find a lot in your psychology world that the Rorschach is fairly well discounted, and I'm going to talk about why and why I think there's a problem with that. Starting in 1990s and continuing for a decade or more, a small group of psychologists, not just clinical, actually Wood's a social psychologist, published a series of critiques on the Rorschach in both scientific journals and lay public. In 1999, Howard Garb, a pretty eminent psychologist who wrote a book called Studying the Clinician, talking about controlling bias in clinical practice, terrific book, called for a moratorium on the teaching and use of the Rorschach. Under the banner of science, this has had a chilling effect on practitioners' use of the Rorschach and other projectives. Why don't we use them more? Well, some of these criticisms were related to blatant misuse of the tests that had not been adequately addressed in the psychological assessment community, concerns about the weakness of the research base, and then other issues involving what I think were bias criticisms under the mantle of good science. This has led to a very, very productive level of scholarship. It's the best thing, actually, Wood and Garb and Lilienfeld's the best thing that's happened to Rorschach science in 100 years, since Rorschach himself published it. There was it led actually to a special series in psychological assessment, which is a premier assessment journal in the field of psychology. There was a major an ad hoc committee for the status of the Rorschach in clinical practice, and the board of the Society of Personality Assessment, which was done with Rorschach people and a lot of non-Rorschach people. I happened to be the chair of that committee and actually wrote the white paper. And then in 2008, Carl Giacono and I published the Handbook of Forensic Rorschach Assessment, where what we did is we gathered basically the scientific base into one kind of book, and then talked about various practices and why you could use it and what the advantages and disadvantages are. Following the publication of Giacono and Evans, the frequency of criticism, interestingly, died down considerably. Much more important, though, is that research has been undertaken to deal with some shortcomings in the external comprehensive system. And I'm not going to go through all of the, let's see. Well, only so. I'm critiquing the critics here. So when we think about science, what are we trying to do? Okay, what is science and how does it fit into evidence? Well, science has to do with empirical data and analysis, It has to do with dispassionate review of existing literature, where you include things that agree with and disagree with your particular point, and you deal with the disagreements, and admission of weaknesses and conclusions and confounding variables. This is kind of boilerplate science 101. But is all evidence scientific? And this is where we get into court, where we have facts versus science. When you're in court, how important is it for you to be, as an attorney, a litigating attorney, to be factually accurate? Do you go along the science model and admit the weak parts of your client's case as well as the strong points? No. It's not what you do in litigation. It's an adversarial process in which there's a selective use of facts to best represent a client's interests. Now, we could say that that also shows up in science as well, and there's a lot of research coming out about research that's funded by interests, which is why we have a disclosure thing, and we start every presentation with a disclosure so that people know where you stand. But basically in court, you're going to use a selective use of facts. And so we have in the courtroom what lawyers call good facts and bad facts. Okay, they're still facts, okay? But what you're trying to do as an attorney, if you're on one side, you're trying to get the good facts and diminish the bad facts. And the other side is going to do the same thing. And it leads to a dramatic presentation where the courtroom is literally a stage for for debate. Hopefully, the judge is going to come down on the side of science. In other words, the judge is the person who weighs evidence along the scales of justice and sees where that lies. Is it a little bit more than 50%? Is it 75% clear and convincing evidence? Or in criminal cases, are you 95%? If you're going to send somebody to jail, you better be 95% sure. That's kind of how it breaks down. So that's really an adversarial approach as opposed to a fact-based scientific approach. So is the Rorschach psychometrically sound? Well, the first thing you have to say is which Rorschach. Are we talking about the external comprehensive system, or that should be RPAS, as opposed to the mistake I made quickly last night, which stands for Rorschach-Performance Assessment System. That's the newer version. If you're not using one of those systems on the Rorschach, or you're kind of spitballing parts of that system, you're not using an evidence-based method. Today, you probably shouldn't use anything that doesn't have empirical basis. There should be a standard administration with good intercoder reliability on the formulation of formulation of the various items. There should be, substantial test-retest correlations. The ones in the Rorschach, there's research showing that there are certain variables that have really good test-retest correlations within a year to 3 years. That's a really remarkable fact within the field of psychological assessment to have that. We're really talking about the measurement of trait when we start getting things that are about the same a year out or 3 years out, if there aren't things intervening like psychotherapy, because personality changes in psychotherapy, and sometimes it changes in other facts in life as well. But short of intervening change processes, we ought to be getting about the same thing 1 and 3 years out if we're really measuring traits. The thing I loved about the comprehensive system, which is why I began to use it, which I rejected the Rorschach when I was in graduate school, which was, I learned the Rorschach in 1972. And there were no really empirical systems. And I thought it was a cool test, and I thought it was really interesting, but I didn't know what I was getting. And I certainly knew that as a middle 20-year-old person, my capacity to interpret complexities of human behavior was really not well developed. And so I really never knew what I got. So, and one of the things I've always liked about the Exner system, which I learned in the late 70s, learned in the late 80s, was that it was constantly being revised based on new research. Now that sounds like science to me, where you have things and you're constantly testing them and you're pulling things out and getting rid of things and adding new things. The establishment of a standardization, normative set, is really a major accomplishment in a test like this, because it takes a lot of time. It really, to get a good solid 600-person normative sample with this kind of test is quite a feat. It's a feat that takes years. And that validity meta-analytic studies, that was the psych assessment series, showed pretty much overall validity of the Rorschach that was similar to the MMPI, and also similar, and I think it's about 0.31, and the MMPI is like 0.32 or 0.33, which is about what we see in personality literature when you're trying to look at personality variables. A good personality, solid personality variable has a validity coefficient of about 0.31 or 32. And the new Rorschach-Performance assessment system actually builds on the empirical basis of the comprehensive system in pretty amazing ways. Okay, let's get to that. It's just, so, this is a little deeper than I think we ought to be running today. So let's talk a little bit about the comprehensive system and what it's done. So what the comprehensive system has done is it's added, 5, I'm going to talk about 3 here, but really 5 new components. One is that they're using, one of the things that messes up a Rorschach is when R, which is the number of responses, moves out of a kind of what they call sweet spot of interpretation. If you get too few responses, interpretation becomes fuzzier. When you get too many responses. And that sweet spot looks like about 19 to 27. And so in the comprehensive system, you could get 100 response Rorschach. I'm doing a conference in several months where we're looking at the Rorschach and other psychological testing data of Truman Capote. And Capote gave over 100 responses. This is a mind that was really, could really churn out a lot of information. Whether that's a reliable measure or not is one of the things we're going to talk about. We're going to do in our optimized version of that while we take a look at the overall testing and see how it changes the interpretation. But in our optimized system says, this is a test, Rorschach test. I'm going to hand you a card and I want you to tell me what it might be, and I'd like you to give me 2, maybe 3 responses to the test. Now that significantly shifts the test in some ways, if you think about it. What might this be, with no instruction about how many responses to give, is a much more open-ended test than give me 2, maybe 3. It turns out that the research suggests that our optimized system actually makes the test wieldier and better interpretively. You lose some data, but you're going to gain more data as a result. It's going to be a more reliable test, and it generally tends to be pretty similar all the way around. Instead of Exner's normative system, and there was a question about whether he had a sample of people who were sort of weller than well, people who, were especially psychologically sturdy, so that when you would get certain variables and you'd see a deviation from those variables, you're not getting a deviation from a kind of average normal person, but the deviations are from an especially sturdy person. And it looks like 25% of those variables, which is one of the critiques that Wood and Garb made, it looks like in about 25% of the variables, the comprehensive system norms tend to over-pathologize, make people seem less troubled than they are. The thing that's most worrisome about that is that form level is one of that 25%, and that's the core of the test. So people who would be seen as pathological in the old set would need fewer minus responses to ring the bell of interpretation, whereas now it's a more generous thing. And what they did, which was kind of remarkable, they took all of the major studies. Rorschach is used around the world. It's used in every continent in the world. Maybe not Antarctica. Not a lot of penguin Rorschachs out there. But other than that, they're Rorschach samples from around the world. And what they did is that they brought those samples together, looked at their sturdiness, and when they were sturdy, they then brought all of the variables together and developed what they call an international reference value. And it makes a less of a tendency to over-pathologize those 25%. There's a critique of that, which is that, have you by, blending culture, and there's some real cultural differences. By blending those, do you then wipe out things that might be culturally relevant? So but anyway. The other thing is that they've developed administration and coding benchmarks that have even increased intercoder reliability. And the most important thing is that Joni Mihira, Greg Meyer, and his group out of the University of Toledo did a meta-analysis of all Rorschach research on 68 major comprehensive system variables. As you can imagine, this was a work of just enormous breadth and scope to take and pull all of that literature together and then to do meta-analytic studies. And as a result, I talked about that. They found 5 levels of strength of validity support. Those variables ranged in strength from excellent, which was above 0.33 validity for 14 variables, and to the absence of evidence, which is no studies published on 12 of the variables since 1974. And they excluded those. That 39 of the variables achieved at least modest validity, and that when they do their interpretive system and they give their printout of the ratios, derivations, and constellations, for every one of those variables, it comes under a chart talking about the level of evidence of, is this strong empirically? Is it good? Is it modest? Is it weak? Or is there no evidence? Of course, no evidence has been excluded. So we now, when we have a Rorschach, not only do we know we have the variables and we have the variables that have some data, but we also identify those, so you don't have to look at a structural summing and say, well, I kind of know the research on that. I can't place that much. I can't place a lot of confidence in that variable. It's all laid out, so it becomes a much easier system both to learn and use and interpret. And they're using t-scores rather than trying to keep in your mind all of the different variables and what the cuts are for those. So here we have variables that are especially good. Almost all form quality variables and special scores variables, which talk about reality testing, make that group. I'm not going to go through this. So in response to Mihira, And I think this is not taught. The major critics of the Rorschach now acknowledge the validity of a number of comprehensive system variables that are now in the RPAS. And that was an article written by Wood, Garb, Nversky, Lilienfeld, and Duke in 2015. The moratorium for the use of the Rorschach has been withdrawn, and especially for the cognitive variables. So the people here in the audience who've heard bad things about the Rorschach, how many people have been taught this particular study? Maybe the first time that you've heard it. This ought to be taught. In science, what we want to do is we want to teach data. And there was one place where they fussed with them about 4 variables, and they added unpublished dissertation to the pool of articles using procedures that contradicted their standards and recommendations for sound research on the Rorschach 15 years earlier, which then showed effect sizes. So there's a kind of, what Mihira and all indicated is that Wood and Garb and Lilienfeld still kind of have an axe to grind and are maybe not using, if they use one thing saying, you shouldn't use unpublished research to do this, and then later come and use unpublished research and say, well, you have a lower effect size when you do that. You begin to question whether this is done on a basically scientific and consistent approach. Okay, so let me, so everybody take a breath. I'm going to, because I just whipped through a lot of information. So the takeaway from this point is the Rorschach is a wonderful test to learn. Learning the RPAS, if you want to learn it, is good. It's going to add in a multi-method assessment information that you can't get from self-report. Because self-report tests have 2 limitations. One is the degree to which a person is aware of their personality issues, and then the degree to which a person is willing to be open about it. We call that response style. People under-report and over-report and things like that. So you have 2 self-report inventories as accurate measures of personality function have 2 important limitations. The other thing that Mihira also wrote about is that if you take a look at self-report tests, their kind of predictive validity, the ability to predict behavior, is weak, which is not often included in the literature, whereas self-report methods like the Rorschach tend to be able to predict behavior on a longer-term basis, in a sort of a personality trait basis, better. So think about using the Rorschach. I always use the Rorschach when I'm doing assessment because I get to see aspects, implicit aspects of a person's personality that I would not otherwise get to see. It's like somebody's got a really bad pain inside. This is for Eugene. We may not just want to only use a topical skin thing. We may actually want to get competent enough to be able to open things up and to look inside. And I think the Rorschach allows us to go deep, allows us to look deeper into our clients. So anyway, so let me talk to you about a kind of an interesting case that I had a number of years ago. And so we kind of bring this home a little bit. This is, of course, a case that shows the Rorschach's value, or else. But in general, this is kind of emblematic of what I find in the Rorschach. So this is a woman in her late 30s. She's coming in. She's a pretty high-level executive near New York City. She had an early childhood history of severe life-threatening child illness with very protective parents, which probably the degree of protectiveness her parents was probably related to the fact that she survived, because a number of these attacks that she would have as a kid could be fatal and without real quick attention by the parents. So, and now she never was in a serious relationship in her life, really, in college or in her young adult years. But then 3 years ago, she met and married a foreign physician from South America who was in the U.S. on a highly restrictive visa, something called a J visa, which is probably the most restrictive visa out there. That's two groups primarily come under the J visas, physicians and professional prostitutes. That the J visa was kind of set up there because it make it very difficult to come to the U.S. and to stay in the U.S. after that visa is up. You have to go back to your country for 2 years and then reapply to come back in, even if when you marry a U.S. citizen. If you come to the U.S. and you marry a U.S. citizen, you show indication of a valid marriage, you can apply immediately for permanent resident status, and you move right on to citizenship. If you're a physician from another country, your likelihood is that you have to come to the U.S., you get your training, you marry somebody from the U.S., and then the two of you and your children have to go back to your country of origin for a minimum of 2 years to then reapply. I think the intent of this law is fairly clear, which is it makes it very difficult for foreign doctors to come to the United States and get established. There is an exception to that visa based on exceptional and highly unusual hardship, in which you have to show that returning to the country would be an exceptional hardship to the U.S. citizen's spouse, child, or parent. And so it's a very, very high bar to jump over. And so we have this person who is, whose husband is applying for this visa waiver, and he has this wife who's a really successful person. And there's a question about whether she very clearly can't go to the country where he came from because the level of pollution in that country would affect her illness in severe ways. That's not even a question. It would be dangerous for her to go to that country. But the question is what it would be like to be separated from her husband for 2 years. Would that be a hardship? Oops. Use this thing. And this woman is a competent individual with a high degree, has been a world traveler. Doesn't sound like somebody that's going to have an extreme hardship in separating from her partner. And yet she claimed that she could not be separated from her husband, and she became, in the interview, absolutely distraught and genuinely distraught at the thought. Self-report inventories, indicated no problems, though there was a subtle indication of naive defensiveness about admitting difficulties, when in fact what you would be seeing normally, you'd see somebody that would exaggerate their symptoms in order to get what they wanted, which is to say, well, like, I'm really messed up and my husband can't do that. This person went in the other direction. So basically, based on the interview and things like that, the only thing we have is this person who's saying that they'd be extremely upset. There was some data to support that. Her therapist said it would be awful, but nobody could really kind of say why. And so basically, as I usually do, I administered the Rorschach. And any Rorschach geeks out there that know what these are? Okay, the Jacono-Malloy aggressive content scales, when you get up above 3, you begin to see people who imagine aggression as a normal part of human interaction. The trauma content index, above 0.25 indicates pretty clear trauma. 0.38 starts moving in the level of dissociation as a traumatic response, and that's a very high score. And then the oral dependency scale of 3, which means is a person who has very powerful dependent pulls. And this indicated past psychological trauma and vulnerability over separation. but that's not enough to take into a judge. So basically I did what was called an assessment intervention, and I said, you know, it sounds like you've had these childhood health issues. They're controlled. You're living in a city where you have incredibly good medical care. These things is not, you know, you clearly can't go to this country, but if you stayed here, you wouldn't be any different than it was before you got married. And so I said, is there anything else? I mean, this suggests kind of a more recent trauma that's kind of left you feeling very vulnerable to being separated from people. Well, it turned out that on 9/11, she was scheduled for a meeting in the upper level of the World Trade Center. But the meeting at the last minute was moved to a different building down the street. As she was walking in the front doors of the building around 9 o'clock in the morning to go to her meeting, the planes hit the building where she was planning to go. And she literally witnessed the destruction of that building, and there were many colleagues and friends on the upper levels. You know, there were no survivors above a certain level. And the offices were there. And then she talked about what the experience was, where she wandered around in a dissociatively helpless state for hours, because you couldn't call, because nothing of that. And she just didn't know where she was going. She just started walking around and did this for practically a day until she kind of came to and recognized that there was a friend that she had and would end up on the steps. And from that point on, she had developed a very powerful fear of being alone. And so, again, anyway, there was a take-home message, but we're really out of time. Basically, here was a case for me where the Rorschach kind of opened up the case. And when it did open up the case, it was able to provide a more humane and deeper understanding of this individual's psychological vulnerability to a degree that the courts were able to grant her, and it's about 1% of cases that get granted who apply for this, was able to grant the husband a waiver so that he didn't have to separate from his wife. Okay, well, I'm seeing it's close to time. I'm happy to stay for a little bit and answer questions. But if people want to leave, who need to leave, go out in the cold, can. Sure. Sure. The person in this particular case who asked for it was the attorney representing the physician husband. And because it's a forensic case, it was not an insurance-based case. So he paid for it. Sure. It's a great question. Yeah. So the question is, what's the cost of a Rorschach? And then the next question, what's the cost benefit of a Rorschach? The cost of a Rorschach is generally 2 hours of assessor time. It takes about an hour to administer. It takes about an hour to score and interpret. And then whatever time you'd want in putting it into a report. Maybe another 15 minutes or half an hour, depending on. What's the benefit is that if you have a complex, I think psychological assessment is really going in the direction of helping to clarify processes, diagnoses, and issues in psychiatric and psychological cases that are stuck or complex and where it's really kind of hard to get a picture of what's going on. And the real value is if you have a client who you've been doing what you normally do and it doesn't seem to be working, then it would be worth the extra time and energy to do a comprehensive evaluation. And you wouldn't ever just give a Rorschach. I mean, I'm a fan of multi-method testing. You know, you give at least one other method, like an MMPI or a PAI. So, you know, again, depending on the question, the complexity of the question, you can have a pretty expensive evaluation if it's extremely expensive. But the other piece is that the data that you get is actually, in my opinion, more scientifically reliable than you would get just on self-report alone. So the way to think about its value is what's its value in complex psychological issues where the person is really struggling and it's not very clear what's going on, and maybe the medication regimen hasn't worked or the therapy regimen hasn't worked. And it's time to bring in another level.
So, given the controversy in its moratorium and the release of the moratorium, would you opine just briefly about its use in criminal forensic assessment?
Yeah, so let me just give you I think Rorschach has certain applications in criminal assessment forensic that are critical. If you have a not guilty by reason of insanity, and if you give somebody an MMPI, what are they going to give you? I'm insane. You know, I have all of these weird experiences. I have that. So what's the advantage of malingering in this? The advantage is very, very high. There's very nice research showing that people who malinger on self-report tests like the MMPI, if you give them a Rorschach, it's very, very hard to fake a Rorschach. It's hard to develop a psychotic profile. You know, if I wish I had brought my card because I would have shown you the bat, and I want you to say, give me a poor form quality response. And just have everybody give them. And I've done this in times before. I've had one person give a bad form quality response. In the present, it's very hard. It's a hard test to fake if you don't know the real details of it. So it becomes kind of like in this past case, in criminal work, it can become a very powerful measure of whether the person has problems with reality testing and thought disorder. That would be consistent with a claim of not guilty by reason of insanity. Is that helpful? Yeah. I love the TAT. The TAT has a monster good research base, empirical base. The problem with the TAT is that nobody, you know, we got 10 Rorschach cards. There are 20 TAT cards. Nobody gives 20 cards. But nobody's agreed upon the 6 or 8 cards to give. So you've got a little bit of a moving target there. And currently, the scoring systems, the empirical scoring systems for the TAT tend to be unwieldy. They tend to be overly complex, and so you end up spending a really long time scoring them. And so I love the TAT, and I use the TAT, and there are 2 scoring systems that are shorter that I'll use with them. The adolescent child version, called the Roberts apperception test, is terrific. It has 16 cards. It's done like the TAT ought to be done. Clear scoring standards, clear variables. Unfortunately, people don't use it so much anymore. So the advantage of the Rorschach over the TAT is the clear administration, scoring, and interpretation guidelines, which are harder with the TAT. Okay. Thank you very much.